Often people come to see us and they've gone to Mayo, they've gone to a local facility, they've seen their local practitioners and they're still having pain. It's super frustrating. What we're good at is figuring out the root cause of the problem. Our goal is really redefining healthcare. We really think that healthcare needs to be delivered differently at a higher level and really research and evidence-based. So with those three tiers, regenerative orthopedics, non-surgical orthopedics, functional medicine, and medical fitness, we can really make a huge difference in people's lives. So functional medicine is basically, I call it functional primary care. I think every patient should be treated this way, but it's kind of trying to get to the root cause of the problem. Why are they fatigued? Why are they breaking down? Why is their joints having arthritis? And it leads to a lot of problems with sometimes their hormones are out of balance, sometimes their body's super inflamed. Sometimes it comes down to diet and nutrition. You can change those things, you can change your life as well. I think too long in society we're like, oh, I want another medication, or give me something to help me lose weight, or I don't want to eat healthy, I just want another pill for my diabetes. But when you can encourage people to kind of collaborate in their healthcare, to start embracing healthy lifestyles, I think that's what really makes permanent changes in people's healthcare. Most patients aren't looking for another cortisone shot, they may not want another surgery, and usually 90% of the time we don't need to send someone to surgery. First thing we need to do is make the right diagnosis, like what is actually going on with that shoulder, that knee, that spine, why are you still having pain? So once you have the right diagnosis, then we can kind of offer the right treatment protocol based on what we know is good and bad for the body. We are finding that there's a lot of new evidence now looking at things like PRP, which stands for platelet-rich plasma. So that's a biologic injection using your body's own platelets. So what is a platelet? A platelet is a cell that if you cut yourself, it bleeds, but the blood brings platelets and it heals that skin back together. Or you've been running, you sprain your ankle, it puffs up, you're gimping around, it's black and blue, but 6 weeks later you're running again. Why are you running? Because platelets flooded that ligament that was torn and it heals it. So now what we can do is we kind of biohack the system. We can pull the blood out with a blood draw. We concentrate those platelets down to about 10 times concentrated from baseline. With the ultrasound you see behind me, we can actually see the defect, the tear, the meniscal tear, the rotator cuff tear, the area of arthritis, deliver those cells to the defect in the body that binds to that area and starts the regenerative process and heals it back up. So I think every healthcare facility needs to get people healthy. You have to really follow lifestyle medicine, which includes good sleep, which includes getting a lot of water, which includes healthy nutrition. So we have a nutrition plan that we put actually all of our patients, clients, anybody coming through the door. It's called Rejuv for Life. It's healthy, clean eating. It eliminates all the toxic stuff, it eliminates the bad stuff, but it's not really a fad diet. It's something you can definitely maintain for life. It's more of a lifestyle. The basis of chronic disease comes from our nutrition, our body habitus. So I added that third tier, which was medical fitness, and that included weight loss, teaching people how to move, how to eat, how to sleep, how to do all those lifestyle changes that are really integral. We've really loved being Weight Park. We're trying to be as involved as possible. We're definitely involved in a lot of Weight Park chamber events. We host a lot of chamber. We're in different BNIs, business connection groups here. We host a lot of different runs that take off right on the Healthy Living Trail, go to Wobegon Trail, come back. So it's a nice destination and a place to start because it's close to a lot of trails. We've got a parking lot there. For years we've done a community garden where we've got extra land where we've planted a big garden. Our staff goes out and we cultivate and we get everything ready, and then we donate all that stuff to local charities in town, all the different produce and stuff. So we love to be involved, and anything that's going on, we're always here to help. I cry with patients every day. We'll be sitting here, we'll talk about what they've done, and then they'll get these tears in their eyes. I get tears in my eyes because we finally give them some hope. I think hope is a huge word that people really lack today because they're given these, okay, you got to live with it. There's nothing we can do. Or let me write you another prescription for some more pain medications, or why don't you try some medical marijuana? And they're like, this is going to be the rest of my life. I'm 42 and this isn't how it's going to be. So I think hope is a big word. I love hope and I love what happens after we treat people. They come back in 3 months and the testimonies are awesome. Seeing them walking again, seeing them carrying the baby, running, playing with their grandkids, those kind of things I think speak volumes because hope can lead to a lot of good things in the end.